Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Solriamfetol. Its brand name is Sunosi. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. But the exact mechanism of action of Solriamfetol, or Sunosi, is still currently unknown. It's thought that its actions may be due to its ability to block the reuptake of dopamine as well as norepinephrine. Now, in terms of indications for use, Sunosi is indicated in the treatment of excessive somnolence associated with narcolepsy. And it's also indicated for the use in excessive somnolence when it's caused by obstructive sleep apnea. Now, before somebody was to use Sunosi, there is a contraindication they must clear, as well as some precautions and warnings that they should be made aware of. It would be contraindicated in patients who have used a monoamine oxidase inhibitor in the previous 14 days. Now, in terms of precautions, patients should be made aware that dose-dependent blood pressure as well as heart rate elevations have occurred in patients using Sunosi. This would be even more of a concern for patients who have pre-existing risk factors for cardiovascular disease. Some patients may require monitoring of their blood pressure and their heart rate and dose reductions as necessary. Patients should be made aware that some psychiatric side effects have occurred, such as insomnia, agitation, or irritability. And this would mean that we would have to use this medication cautiously in patients who have a history of psychosis as well as bipolar. Dose reductions or discontinuation of therapy may be necessary if patients do experience some of these psychiatric side effects. And finally, this medication is not recommended to be used in end-stage renal disease or in patients with agglomeration filtration rates less than 15 mL per min. And once somebody is cleared of that contraindication and made aware of the precautions and warnings, and they start to use Sunosi, they can expect to receive their dose in tablet form. Prior to initiating treatment, the physician would ensure that the patient's blood pressure is under control. So when patients are using Sunosi to treat their excessive somnolence associated with narcolepsy, they would use 75 milligrams once daily upon awakening. The dose may be doubled after about 3 days based on efficacy and tolerability, and the maximum dose would be 150 milligrams daily. Patients should be told not to use the medication within 9 hours before bedtime. The dosing is very similar when you're treating excessive somnolence associated with obstructive sleep apnea, except the initial dose could be 37.5 milligrams. Patients could still have their dose doubled in about 3 days, again based on efficacy and tolerability, and the maximum dose would be the same, 150 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Sunosi, so I'll go over some of those here now. Anywhere from 6 to 9% of patients may notice a decrease in their appetite. About 7 or 8% of patients may notice nausea or vomiting. Insomnia may happen in about 5% of patients, and headaches have also occurred. It should also be noted that some patients do experience anxiety. Thus, more rare but serious side effects would be an elevation in the patient's heart rate, as well as the appearance of psychiatric disorders. That's all we're going to talk about today with Solriamfetol, or Sunosi. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.